Good morning, everybody. I'm Angela Murphy, and I'm a workforce programme manager in the Hampshire and Isle of Wight ICB, but I am also the ICS retention lead, working with my colleagues in other parts of the South East region. Next slide. So as part of our retention programme, which for us started in the spring-summer of 22, we commissioned a report to look at the drivers' retention across our system. And it probably wouldn't surprise you that the availability of flexible working came out as one of the key factors that we needed to focus on. Our people have told us that it's discretionary, that it's inconsistent, it has to be fought for. And it's also quite restricted, I suppose, in terms of what kind of flexible working is offered. And so, along with a range of other work streams, we decided that we would really focus on flex, as we've called our programme, to take this forward, because our retention programme across the system, what we wanted to do was to be able to implement measures and drive change across the 6 or 7 providers that we have in the Hampshire and the Isle of Wight. Our staff survey results, which say that we're okay at flex, but we could be better. We might be average, but it'd be nice to be best. And even, there's still quite a lot of white space above the bars. So there's an opportunity to improve all round, I think. So we felt it was really important. And as Alex said, it's a key driver, I think, for retention across the board. And looking at our ESR and reasons for leaving that are recorded there, if you take out unknown and all the other bits and pieces, then work-life balance was consistently the top recorded reason for leaving across our system over the last 12 months. Next slide. So as I said, what could we deliver at scale? What would be relevant to, if you think about it, we've got acutes, we've got community and mental health, we've got primary care, and we'd also like to be able to reach into social care as well and help to influence retention there. So we engaged time-wise, and basically this is the list of asks that we gave to them to put together a programme to help us to focus on flex in our system. In short, what we're doing is over the next few weeks, we've got a series of 4 webinars. Last week, we had an HR workshop, which was well attended by HR practitioners from across our system. And Amy spent the morning talking to them about job design and tools and principles and how they can help to support their managers when they're coming to them saying, we've got too many requests, we can't do this. So we've done the first piece with the HR workshop, and then we've got 4 webinars that are for managers to attend. And we've tried to make sure that we cover all types of our workforce, but are also able to sort of hone in on different staff groups who have different needs. So we've got one webinar that is for non-patient facing, or what you call sort of maybe more traditional 9 to 5 office type based roles, so that they can talk about flex in that environment. Then we're running 2 webinars for our patient facing managers, because as everybody recognises, that's really the one that we're trying to influence and change. So we're putting 2 sessions on there to try to get maximum impact. And then we're also running a session on for rostered teams, to go into a bit more depth around self-rostering, team-based rostering, and those kind of solutions. So it's looking really positive in that we've had about 450 registrations across those 4 sessions so far. However, how many of those actually arrive, we'll wait to see. But even then, when you look at the attendance and how far we've reached into our system, you can still see gaps where this message isn't really getting through to even come to the webinar. So that's our next piece of work, really, is to focus on how can we drive engagement in the areas that need it the most. And as part of this programme, we're also developing case studies, looking for examples of good practice from within our system, but also using examples maybe like Inga's going to tell us about shortly, from other parts of the country to show that this can be done and how it can be done. And then we're using the NHS guide that Amy and the team wrote anyway as the basis, but we're also developing other materials and practical resources, again, to be able to share with managers. So we'll keep all of that on an internet-based system, because obviously we've got a wide geographical spread, we've got lots of different organisations, so we wanted to make sure this is accessible, and we will use all of our networks to promote this and to drive it. So that's I think that's the next slide. Oh, and I've gone and talked about the next bit, I'm sorry. So I think from a system perspective, what we're really benefiting from is bringing colleagues together that wouldn't ordinarily work side by side, because they're all sitting in their own HR teams in their own provider organisations, and they're sharing experiences, and they're sharing learning, and they're sharing the difficulties, and they're sharing the successes. And also by doing this at a system level, then hopefully we can do this once and do it well. Whereas so often, and I've come from a provider background myself, you know that you've got 6 or 7 teams trying to develop the same policy or the same programme 6 times, when actually everybody's working towards the same goal. So this is the sort of thing that we can do once and do well. And if we can all crack flexible working and we're all working towards the same aim, then as providers, we won't be competing for our staff, and hopefully we can reduce that movement of people feeling the need to move from one place to another because they can't get what they want in their existing employer. And I think that's it from me. Yes, I just thought I'd put a nice slide on to show you how nice it is to work in Hampshire and the Isle of Wight, just in case anyone wants to come down and join us.
It is beautiful. I'm not sure if it would look like that today, Angela, but it's beautiful.
Every day.
Thank you for sharing what you're doing and kind of tackling it from that system level. I think presents real opportunities and challenges as you've set out. Oh, I'm just going to check the chat because I've just seen one question come in. Yeah, just wondering on the chat there, what's worked in terms of spreading the word about engaging with a programme like the one that you're working on when you are dealing with such a range of different providers? What have you found has worked well?
So tapping into existing networks, we've got our task and finish group on Flex. So there is somebody a representative from each organisation within our task and finish group. So we've asked them to go back and use their own internal networks to communicate and spread the word. But also really lucky to have access to a couple of people who are more comms specialists, who I've stolen from our health and wellbeing programme. But again, they're working at a system level. They've got connections across a really broad range of people and organisations, and they send out regular comms packs anyway around everything that's going on in the health and wellbeing programme. So we've blatantly piggybacked onto that to make sure that it's distributed there as well. And I've made sure that the CPOs know about it and asked that they also talk to their colleagues. So I think, as with everybody, our biggest concern is we can sit here and develop these programs, we can sit here and write these wonderful policies, but how does it reach the person on the front line? How does it make the difference? Mm-hmm. But I don't have a silver bullet for that, I'm afraid, but we're just trying our hardest. And I think the people that we're using in comms is probably the biggest help for that, and using their established networks.
Yeah, thank you. I mean, it's not an easy, like you say, there's no silver bullet, particularly when you've got that range and when people are so busy. I think the other thing that I've noticed about your programme is, if you think back to one of your earlier slides when you talked about the feedback you'd had in terms of the type of flex that was available was actually quite restricted, and trying to get people to think more broadly. So I think what you are doing really well is targeting that element. So, you have really focused on job design, and as you said, you're also developing hopefully what will, you know, for a manager looking at one of your posters or some of the information about the resources or the content that's available, they're going to recognise it because you have grouped it by type of staff group, or, you know, kind of linking through to the challenges that they're going to face. I think the risk can be, particularly probably at a system level, but in any complex organisation, that there's such a range that people can switch off if they don't feel it's directly relevant to them. So I think that's something that you've really sort of focused on within the work that you've been doing. Kate's asking,
and we've also developed a poster with a QR code that will look really good on a toilet door, because everyone has a smartphone in the toilet.
Oh, very good. Kate's asking about successes around job design work already. I think I can probably answer that for Angela, in that we've literally just delivered that job design session. But that said, I think that if I think about other work that we have done, I think that we do have examples, Kate, where managers have gone back into their provider organisations and felt empowered to change things like, for example, shift length. I can think of a nice example there from an acute trust where we heard that a manager had kind of really gone away and felt like actually they could go away and for one individual support them to have shorter shifts, for example. So on quite a micro level, but you know, you can take tactically back from a session like that to influence within the team. Okay, thank you, Angela. Thank you for sharing what you're doing at a system level, and maybe we'll get you back in 6 months' time to talk about how it went and what impact you're seeing, because I know that we're at that kind of delivery stage at the moment.
Yes. Thanks, Amy.
Thank you.